All right. Good evening, everybody. I'm Dr. Frank Cadle with Get Fit and Be Lean program that I used to lose over 20% of my body weight in 2021. And this is the Get Fit and Be Lean program multi-platform live stream. I'd like to thank everybody for joining, and I hope you guys will comment, question, put in any kind of input or engagement that you can think of, because it really helps to get the algorithms to drive the live out there so more people can see about the Get Fit and Be Lean program. So typically in the Get Fit and Be Lean program, I'm pretty limited in my scope. I talk about the 2 veggie goal, I talk about portion control, I talk about calisthenics, and the weight loss that I achieved, as well as the decrease in my waist of 5 inches, lowering my blood pressure, all of these things. But this month is Colorectal Cancer Awareness Month. And so all this month, I'm going to be trying to relate the things that I have promoted with the Get Fit and Be Lean program and how those things will impact your risk of colon cancer. Welcome, Mary. Welcome, bikers. Welcome, Peachy and Laura. Really good to have you guys here. I might not be doing quite as much interaction as far as questions and answers. So I would recommend you go to my profile, take a look at my other videos. If you have any questions, put those questions there. And if you have anything you'd like to know about the Get Fit and Be Lean program, you can look at my playlist. You can look at my past videos. I cover different topics pretty much every week. All right. So colorectal cancer, really one of the leading killers in the country, probably number 3, probably the biggest killer of cancer diseases. I guess they got me limited on Twitter to just a few minutes. And the risk factors are very well delineated through just volumes of population research. And that's why I feel so comfortable tying this in with the Get Fit and Be Lean program, because the risk factors are low fiber diet. What do I talk about every day? I talk about the 2 veggie goal, sedentary lifestyle. Calisthenics are intrinsic to the Get Fit and Be Lean program. And then obesity. And obesity is in itself, as measured by BMI, a risk factor for the development of colorectal cancer, the number 1 cancer killer. Alcohol does also play a role, but it appears actually that alcohol intake is lower now than it has been in the past. Tobacco, same thing. It does play a role, but it's not as big a role. And big news last week in the area of colorectal cancer was the increase in diagnosis of people under the age of 40. We don't even start screening people until 45. So Chadwick Boseman, really popular actor, King T'Challa from the Marvel series, died of colorectal cancer. And so I am hoping that this will not go in vain, that it will help to lead people to understand that they are at risk at a younger age. And I think personally, the reason that we're seeing the increased incidence and really a doubling of the percentage of colorectal cancers among people under the age of 40 is that sedentary lifestyle, low fiber intake, and obesity, because you can see that the curves kind of follow each other. So, why didn't evolution rid us of obesity? Because the ability to store nutrition for the lean times was a vital role of our bodies in the pre industrial age when there was not adequate food available for many, many people. And you are here because your ancestors could undergo those lean times without starving to death. So it is not actually an advantageous thing because most of the complications that we see related to obesity and hypertension and high cholesterol don't really impact us until after our most commonly reproductive years. So there isn't any evolutionary pressure on those issues. However, as I said, you guys really don't see me talk a lot about longevity. I don't promote the Get Fit and Be Lean program as a way to achieve longevity. There are some really excellent doctors online who talk extensively about this. I recommend you go to Dr. Terry Simpson's account and look at his lectures about the blue zones and the Mediterranean diet and longevity. Dr. Allo is another one who talks about cholesterol and risk. You don't really hear me talking about that stuff because the fact is, I'm not sure that convincing you that there is a way that you can live longer is really going to impact your day to day behavior. But I do believe that the Get Fit and Be Lean program is a way to increase your functionality. You know, when I started it, I couldn't even tie my shoelaces without getting short of breath. I wasn't hiking. I wasn't taking long motorcycle rides, camping, just the idea of trying to get in and out of the tent. Haven't been skiing yet. I'm probably going to go back up here in the next few weeks and I'll try to get you some videos of that. But the Get Fit and Be Lean program that I designed to focus on portion control, the two veggie goal, and calisthenics actually has a direct impact on most of the risk factors associated with colorectal cancer. So if this is a focus of your own, if you want to know, if somebody came to you and said, you can decrease your risk of developing the number one cancer killer in the United States, if you're the kind of person that would pay attention to that, then I would urge you to pay attention. Take a look at my account, go all the way back to January 1st of 2021. When I started, I was morbidly obese. I had elevated cholesterol, elevated blood pressure. And so all of these things that I've been able to change have been factors of risk for cardiovascular disease, for colon cancer, and other diseases that I've been able to decrease. And I would recommend that you do the same. Now, what are we talking about when we talk about vegetables and colon cancer? What I'm talking about is leafy green vegetables that grow above the ground. And so one of the problems in America is we've kind of stripped down our diets to where when I ask my patients what's a vegetable, all they can come up with is lettuce. And lettuce is a vegetable, good job. But if you're trying to get 2 servings at lunch, 2 servings with dinner, you're going to have a really hard time if you can only come up with 1 vegetable or 2, lettuce and spinach. A lot of people will say tomatoes. I love tomatoes. We're growing tomatoes right now. They're delicious. They are a berry. They're a thin-skinned organ of reproduction that contains seeds and the nutrients for the reproduction of those seeds. So that doesn't really qualify. Carrots are a tuber. They grow beneath the ground. They store starch for the organism, not really qualifying for the kind of impact that I'm looking for with the 2 veggie goal. So lettuce, spinach, cabbage, arugula, kale, asparagus, fennel, celery, all of these leafy green stem-containing things that grow above the ground, these should serve the basis of the 2 veggie goal, 2 servings with lunch and 2 servings with dinner. And it does all kinds of different benefits. It adds all kinds of different benefits. It increases the bulk of your meal, and this increases your satiety, that feeling of being satisfied after eating. It provides all kinds of different nutrients and vitamins, micronutrients, iron, those kind of things you can find in different leafy green vegetables that grow above the ground. Rheumatoid arthritis or connective tissue disease, as I frequently say when people ask for a device with multisyllabic, multiple diagnoses, you need to talk to your physician about that one. So, no, I don't really buy into the idea that food as medicine, like I said, you don't hear me talking about longevity and food as medicine and all of those catchphrases because I don't really take that angle because it doesn't really work for me. And the reality is, what I'm interested in is being able to do what I want to do for a longest period of time possible. And that's why I focus on BMI. BMI is not a racially oppressive tool of the patriarchy. BMI is just a combination of your height and weight. If you don't like BMI, go with your height and your waist circumference and try to make sure that that number is 2. All right. So I do these scheduled 7:30 p.m. multi-platform lives once a week at 7:30 on Sundays. And I do try to address individual questions, but it's a lot easier to address them in a specific video that I put on my TikTok account. I don't get much traction on Twitter, but you're welcome to go there. The Get Fit and Be Lean is on pretty much every social media platform, so you should be able to reach me any way that you want. And if you have a question about a particular topic, I'm more than happy to address it. All this week, I'm going to be talking about colorectal cancer, dietary fiber, the 2-veggie goal, and the role it can play in this devastating disease and decreasing your risk of developing it. I've had many patients with colorectal cancer. It can be fatal almost immediately on presentation if people come in obstructed. It can be a treatment that requires repeated surgeries and chemotherapy or radiation. It's a really tough road. And so if I can help somebody decrease their risk for that, I'm very happy about that. All right. Welcome, Rowan. Thank you very much for joining. Really good to have everybody here tonight. Go Hokies, NCAA women's basketball champions. And please take a look at my videos, take a look at my Twitter account, make some comments, ask some questions. It always helps to get the video out to other folks if there's more engagement. And if you find that I don't answer your question, you can try DMing me. I don't take a lot of DMs, but I am trying to continue to put information out there for people to access. And really, if you want to go to the source, my Twitter account carries links to all of the different resources that I've used to devise the Get Fit and Be Lean program. And you can click on through and read to your heart's content if reading is a better way for you to absorb the knowledge. Welcome, Betty. Welcome, Tommy. Welcome, Delio. Good to have everybody here tonight. Really nice to see a big turnout. And I appreciate you guys coming by. I appreciate you getting engaged in my videos, making comments, making questions. And I hope to see you doing so again. But I think we're going to cut it for tonight. We're getting down in the single digits. Please be looking for my videos in the future.